what just happened. Hello. Did it work? Is everything broken? If you came over from Aaron's stream, you know that there was like a minor meltdown that happened because of a power outage, because all of this being related to the fact that it's like going to be 99 Fahrenheit in Portland today, and it went from being like a rainy June to being 99 Fahrenheit all of a sudden, just like 37 Celsius if you don't know. So hot. And like the whole that meant that we tried to run our crappy little air conditioner, and our apartment has pretty much almost everything except the kitchen all on one circuit. And so we blew a fuse. The fuse blew, knocked out some live stream equipment, didn't realize it had knocked it out. It was actually like a couple days ago. Didn't realize it had knocked it out. So I was not capable of running the live stream myself. So Aaron had to leave his stream early and race back across town in order to come run the live stream. So please say thank you to Aaron for the panic bike ride across the city to run the stream. So it seems like everything is now working. Yeah, Eric says that things are working. Christopher says, ouch for the heat. Yeah, I mean, the thing about the heat in Portland, I know a lot of other people are like, well, it's 37 all the time where I live. The thing in Portland is that we've only been, in the past couple years, due to climate change, really been getting these really hot days. And these really hot days, like Portland is built to keep mold out and to keep rain out. That's how we build houses. Air conditioning was not a priority. Like, even things like ceiling fans are not normally installed. So, like, we have one ceiling fan in our 2-bedroom apartment. We have nothing in the bedroom. We have nothing in this office room. And it's essentially just like, we are not well set up for it. It's actually, I don't know if ironically is the word, but we're, June 28th last year was the day that we had 115 Fahrenheit weather in Portland, which I think is like 45. I mean, it was crazy. Yeah, it's over 45 degrees Celsius. And 60 people in Portland died, and almost everybody that died in Portland died in their own homes because people just didn't have air conditioning, and we don't have any air conditioning installed in the units in our building. But we do have like a hole to put a window AC, but as demonstrated, that can bring down the rest of the power. So yeah. Aaron says, speaking of which, if this stream randomly goes offline, it's probably because a breaker tripped again. Correct. Everybody says kudos, thanks to Aaron. Yes, thank you, Aaron, for making this all possible. So, this week, it was a rough week here in the United States. So essentially the way that our Supreme Court works here, from what I understand, not being a lawyer, is generally decisions there's a docket that happens every October. The Supreme Court decides which cases they're going to hear. They hear oral arguments over the course of like 6 months. So they hear oral arguments, then they go back, they decide about what they're going to do. And the oral arguments are open to reporters. So we usually have transcripts. We also have audio most of the time of those. And, there's a lot of cases that the Supreme Court hears that are not particularly interesting to the average person, because they're often about like some sort of nitty-gritty thing that doesn't affect very many people, by the time that it gets to the Supreme Court or whatever. However, there were some really big decisions this week that you've probably heard about. I'm not going to talk about the overturning of Roe v. Wade because I'm not an expert, and there are plenty of people that are making media about that. There was also a big gun control decision made this week, which essentially invalidated states' gun rights. So a lot of folks that aren't even in the US have heard coverage of Supreme Court decisions this week. NNLS on the Oh My Dollar forums, who lives in Australia, was like, what is going on with your Supreme Court this week? And I was like, well, the way that they do it is they go away and they argue, and then at the end of their session, which they're almost done with their session, they'll roll out decisions. So because of the leak with the Roe v. Wade decision, we actually knew a month ago, which, by the way, one of those leaks about a decision has never happened before. My own suspicions are that it was when someone that clerks for one of the Supreme Court justices saw how it was going, they leaked it knowing that, there would be, they leaked it for safety and or preparation reasons. I don't know. It's still being investigated, like how that leak happened, because it is a big deal to have leaks coming out of the Supreme Court. This is not great for the integrity of the highest court in the land. All of this to be said, they released other decisions this week because they're in the final opinions coming out. And one of the decisions they released isn't getting a lot of media coverage. I mean, even on Kaiser Health News' podcast, which is a very niche, people don't listen to Kaiser Health News podcast unless they have a deep interest in healthcare policy. Even in that case, they didn't want to get into the weeds on this decision. But I think it is important to get into the weeds on this decision because it sets a really bad precedent. And that's what the Supreme Court does. They set precedents. When decisions are made by the Supreme Court, when cases get all the way to the Supreme Court and they set decisions, unless something happens on the legislative side of things, that precedent will inform lower courts' opinions. So there are quite a few things that we might not see reach the Supreme Court that now will get determined by lower courts based on a Supreme Court decision. And so it's very, very important. Aaron is working on things to see if we, in case we die or whatever here. So Meteor Rex Connection says, clap emoji, thanks. Christopher says, basically throwing out the babies with the bathwater. The worst part is that I don't actually even know which decision you're talking about when you talk about that. So all of this to be said, we will have something optimistic because it's been a hard week, but I have this circus animal donut, which is even more ironic because it's a vegan donut, but it looks like circus animals. But look at this. It's got little animal crackers and sprinkles on it. So this is what we're going to do after we talk about this depressing court case, because this court case is, it is so in the weeds that it doesn't seem important to people. It's not going to make big news, but the fact that the Supreme Court decided on this thing is can have huge implications for healthcare and insurance for people with other chronic diseases. So because of the precedent set. Christopher says, you have the heart to eat this. I will eat it. I think what helps is that the animals don't really look like any specific animal. I mean, look at that. They're not that cute. They're kind of like last night, Aaron had me draw a cow with no reference photo, and it kind of looked, because I'm not very good at drawing animals, my cow kind of looked like these, which is to say pretty undefined. So yeah, I think I can handle it. They are kind of emoji animals. Oh, Aaron's trying to show off my really bad, yeah, that was my cow drawing, which is compare, which is, it's the same picture, right? Emoji animals. I think emoji animals are better because professional artists make them. Mary Jo says, they're so cute. Give them a noble, delicious death. Hopefully it will be noble. New Bold One says, I see no difference. Yeah, I guess we could decide that they're cows, but only cows drawn by me. Okay, so we're going to talk about this decision, and the reason I want to talk about it so much because it's going to be ignored in the context of what is extremely important other Supreme Court decisions happening, which I am, of course, extremely mad about. But I think it's important to talk about this because the precedent could really have huge consequences and effects. So in order to set the stage for this Supreme Court decision, which the one we are talking about is Marietta Memorial Hospital Employee Health Benefits Plan versus DaVita Inc. To get the idea, this is the insurance plan for a hospital in Ohio, and DaVita Inc. is one of the major dialysis providers in the country. Dialysis is what you get if you are in end-stage renal disease, which is kidney failure. Dialysis essentially is a thing you usually need 3 times a week, roughly. Kind of depends on your on what kind of kidney disease you have and which type of dialysis you opt for. It is the thing to understand about dialysis before we kind of dive into understanding how it interacts with Medicare is that dialysis is not optional for people with kidney failure, and almost everyone with kidney failure is getting dialysis. Your options if you are in end-stage renal disease is that you either get dialysis, you get a kidney transplant, for which you would usually have dialysis while you wait for a kidney transplant, or you die. Those are the 3 options that you have if you are in kidney failure. Dialysis essentially is a process where your blood is taken out of your body and cleaned because that is what the kidneys do. Okay, just to clarify, in addition to not being a lawyer, which will be important when it comes to this discussion, I am also not a doctor. So, this is the layperson's understanding of this. So that's what you need to understand about dialysis. What it does is it does the work of the kidneys when the kidneys can no longer do that work. Another important thing to understand about end-stage renal disease is that it is quite commonly a stage that people get to at the when they have untreated or unmanaged diabetes at the very kind of end as a consequence of diabetes, particularly type 2 diabetes, but it could be either type of diabetes. And then the other thing to understand about it is that it is very commonly needed for people with late stage AIDS. So there's lots of other diseases that end up in kidney failure. Regardless of what your primary diagnosis or the reason you're in kidney failure is, you are considered an end-stage renal disease patient if you need to get dialysis. So we need to wrap our heads around the fact that if you are receiving dialysis, 99.5% of the time, you are an end-stage renal disease patient. 0.5% or less of people receiving dialysis would not be qualified as having end-stage renal disease, because why would you be getting dialysis if you're not in end-stage renal disease? The other thing to understand about end-stage renal disease is that if you are in kidney failure, if you have end-stage renal disease, you will be receiving dialysis, right? Or you're dead, right? So, and if you are awaiting a kidney transplant, which is one of the options for treating end-stage renal failure, you are often on dialysis while you wait. So it is a almost perfect proxy. If you're receiving dialysis, you are in end-stage renal disease. So Jenny says, to clarify, oh, thank you. I appreciate having a medical professional to clarify. To clarify, if you are on hemodialysis, you are no longer a candidate for peritoneal dialysis. If you need hemodialysis, you will die a very, very bad death without it in a period of about 2 to 3 weeks. Yes, so thank you for clarifying. There's a couple different types of dialysis, essentially, and the patients work with their care team to determine it. The type of dialysis that is provided by DaVita is just outpatient, so it could be either one of these types of dialysis. And the outpatient dialysis means that you physically go to the dialysis center. There are two main providers that provide 95% of outpatient dialysis in the United States. So it is important to understand that when a insurer chooses to make one of the two providers that provide dialysis for almost everybody that receives outpatient dialysis in the United States, then they are denying, if they make those out of network, which is essentially saying oh, we're barely going to cover costs. We're not limited by cost sharing rules that essentially limit how much patients pay under the Affordable Care Act because we've made it out of network. If you make both or one of those out of network when they are the only option for getting dialysis for patients, you are essentially saying, fuck you. Right? There's not another option for outpatient dialysis. There's also inpatient dialysis or home dialysis. Inpatient dialysis would be if you're in the hospital, which usually would be you're being admitted to the hospital for a kidney transplant. And then the other option would be home dialysis. Home dialysis is actually practiced as the main treatment outcome for a lot of people in kidney failure under other medical systems. One of the reasons that outpatient dialysis is such a common procedure is actually because of lobbying by these large private providers of outpatient dialysis, which one of these is the plaintiff in this case. So it is important. It's important to understand that as everything what I talk about with healthcare in here, there isn't really a good guy, right? Half the time when you are talking about court cases that are essentially screwing over patients, the plaintiff is some sort of private company that stands to benefit from people paying for that treatment. And that doesn't mean that it's not important for patients. The root of this whole copay accumulator situation that I've been in for quite a while, where my drug costs $12,000 a month, and most of that cost is paid for usually by the manufacturer assistance of my drug, which essentially is the pharmaceutical company that makes my drug saying, ooh, we have a really expensive drug. We can make it whatever price we want if we pay up till the patient's out-of-pocket maximum for this drug. And then they get to collect after I hit that. They make me price indifferent as a patient. I get a drug I desperately need, and then they get to collect whatever the price that they charge in a monopoly market because my drug has no generic available in the US. So it's once again, when I am doing advocacy against copay accumulator programs, I am essentially on, if you look at who funds the advocacy organizations for rare diseases or just expensive diseases that aren't even rare, who funds it? Pharmaceutical companies. Who funds it? In the case of dialysis, well, the two main providers of outpatient dialysis are funding the patient advocacy groups because in the end, patient advocates are going to advocate and lobby for things that make sure they get the care they need. But in a sick way, you're often lobbying for a private company to be able to collect outrageous amounts of money. So all of this to say, in 1972, actually, there's one more thing I kind of need to explain. I think most people know this. I've talked about it a lot on this stream, but in the United States, we have almost universal healthcare coverage for people over the age of 65. This is called Medicare. It is different than Medicaid, which is for low-income people and some people with chronic illnesses and diseases that aren't low income. But Medicare is available to people over the age of 65. However, Medicare is also available to people below the age of 65 if they have two specific diagnoses, and that diagnosis has no waiting period mostly. in order to qualify for Medicare. And the reason these diagnoses are eligible for Medicare before the age of 65 is partially because the treatments are hella expensive, one of which is dialysis, which, as you can imagine, it's really expensive to have your blood taken out of you and cleaned and put back into you several times a week. Like, I think we can, like, instinctually understand that's probably an expensive process, but it's extra expensive in America, where we make money off of making sure people don't die. So there are two diagnoses that qualify you for Medicaid with essentially no real waiting period if you are under the age of 65. And this is people in end-stage renal disease. Guess what? The whole thing we've been talking about, kidney failure. And then the other one is ALS, or Lou Gehrig's disease, which is relevant overall to this, but we are going to kind of not dive too deep into that because it wasn't what this ruling was about. ALS is not treated by dialysis unless you had like a different conflict coming from ALS. But it also has very expensive treatments. So the other thing to know is that you can be enrolled in Medicare below the age of 65 if you qualify for Social Security disability insurance, which essentially means that you are permanently disabled and or you have a disease that will likely result in your death. And you have to have enough quarters of work. We're not going to get too deep into that. But there are multiple diagnoses that can qualify someone for Medicare enrolling after 2 years of receiving Social Security disability insurance payments. We don't need to get into the problems with SSDI and like how a lot of people end up waiting 10 years before they actually get on it. But there are, lots of patients with Alzheimer's disease, mental illness, multiple sclerosis, Parkinson's disease, cancer that you expect to result in death will qualify to get on Medicare. And there are also patients that enroll in what is called Medicare Advantage, which essentially can be available to some patients prior to turning 65. That's quite often patients with congestive heart failure or cystic fibrosis, essentially rare diseases that congestive heart failure is rare in patients under 65 generally. And cystic fibrosis is extremely rare, but they have very expensive treatments. So what is important to understand is that in 1972, essentially Congress passed this ruling that said Medicare coverage is available to individuals with end-stage renal disease, regardless of your age or disability. And the reason this is important to understand is there are lots of patients who are able to continue to work in their jobs where they might have employer coverage. They might be able to, they might not be receiving Social Security disability insurance payments because they are still on a waiting list. But there is a special exception for people that are in kidney failure as of 1972 that says you can enroll in Medicare. And essentially, the second that you are either admitted to the hospital for kidney disease or for a kidney transplant, or you start receiving dialysis, you are eligible to apply for Medicare. And the thing to understand about this is that when this was passed in 1972, there were very few people that had end-stage renal disease because we were not as good of taking care of people with kidney failure. We had dialysis as an option, but there were other diseases that the complications of would kill people that now we're better of treating, that maybe were in end-stage renal disease, but now we're able to treat the other symptoms of whatever they have. Additionally, the prevalence of diabetes part 2 and diabetes part 1, because we're much better at treating diabetes now, and therefore people with diabetes, either diabetes type 1 or diabetes type 2, are living longer. And quite often, end-stage renal disease is an outcome of someone that has diabetes. So, I mean, we're getting a lot better at not making that happen now, but there are more people, essentially, that are covered under this end-stage renal disease because of our advancements in essentially treating them and keeping people alive, which is a good thing, right? Right? That's great. An example I like to give of someone that would be covered under this is if you've watched Modern Family. Modern Family, one of the actresses which is like a long-running television show, I think it's like 8 or 9 years it's been on. One of the actresses on it that plays, I think her name is Haley, she has had kidney disease her entire life. She went into kidney failure and rejection from her first transplant that she got when really young while she was on that show. She was still a working actress that was recording like a top level television show, and she was doing dialysis still 3 times a week while she waited to get a second transplant. So she was doing dialysis 3 times a week for a whole year. And she was covered under her guild insurance, which would be employer-based insurance under the Actors Guild. And she, you wouldn't know. And this is why it's important to understand there are lots of people who are receiving dialysis that are still covered under employer-based plans. She's like a very prominent example. She's gotten a second transplant. She's doing well, just so you know. But it is like, I think it's really important for people to understand why this specific carve-out was made for end-stage renal disease. But the other thing to understand is there are a lot of other illnesses that have kind of exceptions or programs under Medicare, which is paid for by the government. So, let's kind of emphasize that, that have essentially other programs that kind of kick in. So, where people are now more and more able to work and might be covered under an employer plan. And like a great example of this is the Black Lung program, which essentially Black Lung disease is almost entirely people that had worked in coal mines. And there's a special Black Lung program that I think some are veterans as well that went to Vietnam, where they had used weapons that were very Agent Orange and stuff. The Black Lung program is a great example of there are people who work that are receiving a special carve out under the Black Lung program and are also receiving Medicare. There is also another program called the Ryan White program that was established in 1990 that covers most people that are low income, but may qualify for an employer plan, that have HIV and AIDS. It's AIDS. It's once it's turned into AIDS, I think, for most of these people. But the Ryan White program and ADAP also are specific carves outs for people with a specific disease where no one is receiving the fast acting antiretroviral therapy that isn't in AIDS, right? It's important to understand there are other things for which there are treatments that are a proxy for having a disease that has special government-funded programs to cover the specific thing that they need for their treatment. Jenny says hemodialysis takes about 4 to 5 hours per session. Vitals are done every 15 minutes by a nurse during that time, and treatments is slowed down if your vitals dip 3 times a week. Thank you for the specifics about this. I appreciate having a medical professional in the chat because I am much more concerned about the overall economics of the situation, but it is important to get a picture of this. Eric says, when there's 2 providers for a thing, think baby formula, bad things will happen. Yeah, that's even extra true when the government is locked into paying for something, which is exactly where we're at with this dialysis case, right? So, All of this to say that Medicare, the way that it is done is it covers 80% of the costs of dialysis, and it also covers 80% of the costs of post kidney transplant immunosuppressive therapy. We're going to focus on the dialysis. The other 20% of those costs would be covered by something like a Medigap Insurance, which is a plan that, like a private plan that you can elect to get. It's very commonly used by people with disabilities that are under the age for Medicare. It could be covered by a Medicare Advantage plan. It could be covered by sometimes other kind of assistance, but Medicare covers 80% and 20%. However, there was essentially in, God, what year was it? Let's find out what year it was. Okay, in 1980, the Congress kind of looked at the fact that we had added Medicare as, we had added people with end-stage renal disease to Medicare. There's a possibility that these people qualify for employer-based plans, or maybe they qualify for other coverage, like Medicaid, for example. Which is also government funded, but let's focus on Medicare here. They figured out, oh crap, there is an incentive for private insurers to try to get people off of Medicare as quickly as possible, or get people off of their plan and onto Medicare as quickly as possible. The rule in general that they passed with the Medicare Second Payer Act says that your employer-based health insurance, or COBRA, which is essentially like if you stopped working for any reason, you got fired, laid off, then you can extend your coverage by staying on COBRA. So you pay the premium rather than your employer, but you have access to it, which before the ACA passed, that was like our only option. So they figured out, like, there's a perverse incentive. Why would private insurance want to pay for dialysis, a super expensive treatment, when they know that the government would pick up the tab anyway if these patients were on Medicare? So what they did is they established the Medicare Second Payer Act. And the Medicare Second Payer Act in 1980, let's read the actual language from it. One, the important thing to understand is from the provider side, the Medicare Second Payer Act prohibits accepting payments for services from a patient upon admission if another insurer is primary. If you're performing this practice, you must stop immediately if you are a provider. There are explicit rules in the Medicare Second Payer Act about how long a different plan covers things before Medicare becomes the primary insurer. Specifically, when it comes to kidney failure and end-stage renal disease, it said that the private plan from the insurer has to cover the patients for 30 months as the primary insurer prior to, and then at that point, Medicare and the private insurance would flip-flop. So after 30 months, a little under 3 years, 2.5 years or whatever, then Medicare would become the primary insurer, and then that last 20% part would kick in, and that would be the commercial insurer. But they realized, so the whole point of that was to try to make it impossible for private plans to start kicking people off early, because they realized, God, these people are expensive. This is affecting our profit margins. What if we just told them they couldn't qualify for health insurance? You know, what if we found a way to kick them off? And it explicitly says that you cannot decline to, that private insurance is not allowed to decline payment for patients with end-stage renal disease. So all of this comes back around to the actual court case. The actual court case, which was Marietta Memorial Hospital with Employee Health Insurance Plan versus DaVita. So Marietta Memorial Hospital Insurance Plan is a hospital plan for their own employees to get health care. And what they did is they made every dialysis provider, of which there are only really two primary, out of network. And by making it out of network, they made it so that almost none of the costs were covered. They gave absolutely atrociously low reimbursement rates, making the patients have to pay for the cost, or those patients to get on Medicare earlier than the first 30 months after they qualify for dialysis, essentially making it so that patients are more likely to switch to Medicare. The important thing to understand about the decision by Marietta Memorial Hospital was that they limited reimbursement rates for dialysis, and they made it so there was no in-network option for dialysis. But they didn't say patients with end-stage renal disease, which is what the decision was determined on. Instead, they just said, well, all patients receiving dialysis get like $2 back as a reimbursement rate, making it pretty much impossible for patients to access dialysis using their insurance as their primary insurer. This is what the decision was determined on. Despite the fact that Congress explicitly passed the Medicare second payer statute in 1980 in order to make it so that it is not possible to discriminate against patients with end-stage renal disease by not providing them coverage and limiting their limiting their coverage of the necessary treatments and forcing those patients onto Medicare early. Why did they pass that? They explicitly did it to save money for Medicare. Because if a private insurer should pay it, they should pay it. You shouldn't be able to just say patients are really expensive, we're kicking it off, and the government picks up the tab. So all of this leads up to the decision that they made. So they had oral arguments in March, and at the time, SCOTUS blog that was covering the oral arguments. So SCOTUS blog is an independent news source that covers Supreme Court decisions. I find them very helpful for breaking down stuff that I don't know the ins and outs of because I am not a lawyer. But if anybody wants to pay for me to go to law school, I will become a lawyer, just so you know. So all of the things that you need to kind of understand about what the oral arguments were is, at the time, SCOTUS blog really seemed like it was going to come down on the side of DaVita. DaVita being the dialysis provider that sued Marietta Memorial Hospital Employer Health Insurance Plan on the grounds that by making it incredibly low reimbursement rates for dialysis, they were violating the Medicare Second Payers Act. And at the time that they were talking about it, it seemed SCOTUS was like, yeah, unless there's a silent majority on the court, then it seems like it'll come down on DaVita's side. Once again, remember, this is the Supreme Court, arguing about a law in Congress, a statute that Congress passed explicitly to save Medicare money and make sure that private insurance does not try to kick off people in kidney failure. Well, everybody was surprised when a 7-2 decision came out in favor of the employer health insurance plan. And the way that the majority opinion was written, essentially, they made the argument that an incredibly legalistic reading of the statute that essentially said, well, because the employer health insurance plan is just refusing, is making all dialysis out of network, doesn't mean that they're discriminating against patients with end-stage renal disease. It means that they're discriminating against dialysis. And therefore, there is nothing wrong with this. And the dissenting opinion, which was authored by Justice Kagan, and it was Sotomayor. Justice Sotomayor was the secondary on it. Essentially said, cited other opinion and repeated something from the oral arguments that said, well, if 99.5% of patients receiving dialysis have end-stage renal disease, then this extremely legalistic reading of this is not fair because it's an almost perfect proxy for end-stage renal disease if you're receiving dialysis. 99.5% of patients receiving dialysis are in end-stage renal disease, which is explicitly what the statute was written as. So essentially, this opinion allowed the private insurance to be like, well, we found an end runaround in order to cover these patients on Medicare. And this is specifically really important here because, one, I really liked the oral argument where Kagan wrote, a reimbursement limit for outpatient dialysis is in reality a reimbursement limit for people with end-stage renal disease. And so a plan singling out dialysis for disfavored coverage differentiates in the benefits it provides between individuals having end-stage renal disease and other individuals in a way that is not permitted under the Medicare Second Payer Act. And specifically, I think what is interesting about this, which they cited from other opinions, was a tax on wearing yarmulkes is a tax on Jews. So even if occasionally non-Jewish people are wearing a yarmulke at a bar mitzvah, if they're wearing a yarmulke at a wedding, that does not mean that a tax on yarmulkes is not a tax on Jews. And just the same, a lowered reimbursement rate for dialysis is a lowered reimbursement rate for patients with end-stage renal disease, which is explicitly what Congress passed the Medicare Second Payer Act to provide. So this was very much on the side of, came down on the side of this employer plan. And okay, the good news is that, hemodialysis is in place for patients. No one on hemodialysis wants to be on hemodialysis. It is life-saving. It's not just something you can say, let's do this, it's too expensive. This is horrifying. Yes. So I guess the good news to understand is that actual patients will, yes, this is going to involve a scramble, but actual patients will get covered because they're going to have the opportunity to go on Medicare early. And Medicare will then pick up the entire tab. But what is important with this decision, it's a shitty decision, but what's even more important about the shitty decision is it's setting precedent that allows private insurance to essentially find end runarounds in order to not cover expensive diseases, which we have already seen private insurance doing a ton of. So, insurance are allowed to pick, under the Affordable Care Act, there is a list of 10 essential health benefits. And these essential health benefits essentially say that to be an ACA covered plan, you have to cover certain things. You have to cover preventative services. You have to have prescription drug coverage. You have to have, certain kinds of screenings are included in essential health benefits. You have to cover people having kids. There are various things in the essential health benefits. However, how insurance is allowed to interpret essential health benefits has led to this kind of problem, which is what I'm currently being affected by, which is essentially they started making a carve out of things they consider non-essential health benefits. One of those is that they created a secondary class of prescription drugs called specialty drugs, and these specialty drugs are, by and large, extremely expensive drugs with no generic available. And look at me, what I take. And so essentially they carved out from prescription drug coverage, specialty drugs that are quite often drugs used by people with autoimmune disorders and drugs used by people with cancer. So all of this to say, they already have been working very hard of finding ways to do end runs around the law in order to not cover expensive drugs. And expensive drugs, expensive treatments. And this is explicitly one of those things where they already found a way to carve out autoimmune disorders, certain kinds of cancer, away from the original intent of the Affordable Care Act. And particularly, this got worse because the Affordable Care Act initially said, okay, our ruling, the HSS, which is who regulates health insurance plans at the federal level, HSS said, okay, well, you cannot cover prescription drugs, and you're not subject to the limits on how expensive they are, if they're classed under specialty drugs, as long as there is no generic, as long as there is a cheaper generic available, which is how you end up with insurance companies that essentially say, like, okay, we'll cover the generic, but we have almost no coverage whatsoever for a drug that, if you want to get the brand name. A lot of people run into this with their insurance, and that was a specific carve out that they made. But in July 2021, last year, what happened was, as HSS essentially started to allow plans, even if there was no cheaper generic available, still class drugs as something not subject to the essential health benefits ruling. And that's exactly what fucked patients like me this year with copay accumulator programs, which I don't want to get too deep into it because I've done, like, I don't know, 3 fucking live streams about it, and I'm going to be doing an edited video soon about it. So, I think what is important to understand, one, this whole statute that was passed in 1980 was explicitly done to prevent private health insurance from being able to force all of the cost onto Medicare. And, like, there have been a number of other statutes specifically around things like black lung disease, Ryan White, which is the program that covers AIDS drugs. There probably are likely going to be coverage under COVID-19. And then one of the last and most important ones that is being debated right now is finding a way. It was originally part of the Build Back Better plan, but they can't pass that in Congress. It's limiting prescription drug costs, and specifically one of them is insulin, which has gotten out of control expensive for a lot of people, despite the fact that it has no patent, and the person who discovered it explicitly did not patent it and made it so that it wouldn't be. Anyway, all of this to say, insulin has a pretty big appetite for fixing it, and that Congress might pass, like, a limited kind of situation around prescription drug coverage. They seem real shit about passing anything right now. But this is the problem. If these statutes about proxies for diseases is being passed by the Supreme Court, and they're setting precedent to essentially say a service that is received by 99.5% of patients with end-stage renal disease doesn't mean that the insurer is discriminating against people with end-stage renal disease, then what is to say of these other statutes that explicitly carve out protections and coverage for people with other expensive to manage diseases? What is it to say for other people that are affected by the Medicare Second Payer Act, which is people with black lung disease, people with HIV/AIDS, people with disabilities that are receiving SSDI for 2 years? Like, there are a ton of people. Multiple sclerosis patients are very commonly affected by the Medicare Second Payer Act. Like, it is important to understand the precedent that is being set for this. And it is frankly terrifying because, in my opinion, this is explicitly a way to listen to the concerns of insurers at the expense of the public when it comes to Medicare, because that is a federally funded program. It's funded by all of our tax dollars. And it is also a way for private insurers to find new end runarounds and be supported by this Supreme Court decision by patients that don't have the option to go on Medicare early, by patients like me that are covered by an employer health insurance plan. It's going to be more and more possible for these health insurance companies to look explicitly at the text of the statutes that are meant to protect patients with certain diseases, meant to protect patients in general, and find extremely legalistic readings of them and not cover things. So, yes. Eric says insurance company and runarounds are US. Exactly. Fuzzbubble says this is so infuriating. I know. Eric is referencing the other decision this week, but if the US Constitution doesn't mention dialysis, you don't get dialysis. It's so incredibly frustrating to talk about this because the actual, this decision, one, like I said, it's barely covered by media, and the immediate effect on dialysis patients is probably going to be relatively limited because essentially they are probably going to be able to access Medicare for all of their insurance costs, all of their healthcare costs prior to the 30-month window. But it's bad news. Another thing to understand is things like Tricare, which is for veterans or active duty military, and as well as some federal employees. So Tricare is also subject to the Second Payer Act as well. And it is the Medicare Second Payer Act as well. And so there are a lot of people that are generally possibly affected by this ruling on the Medicare Second Payer Act. Mary Jo says, God, this is a nightmare. I know, that's what's so frustrating about it, because it's like, this sucks as a decision. And the thing is that Congress will probably find a way to pass this, because the thing that's very frustrating to me and was mentioned in Justice Kagan's dissenting opinion was quite explicitly like, this is defining things. This is reading not the intent of the statute that Congress passed, but instead is reading an extremely legalistic reading of the statute, but not the intent. So Congress will fix this, right? Because they want to limit cost to Medicare. They want private insurance to have to kick in. What the fuck is the point of a private insurance network of systems that majority of Americans receive their freaking healthcare from if they don't ever have to pay for anything? Right? What is the point of insurance if they do everything they can to not cover things? And instead they just want Medicare to kick in as soon as things get expensive. It's just, anyway, yeah. Should we eat a donut, y'all? If people have questions, I have this many pages of notes on this situation. So if you have more questions, I can probably answer them, but I think we'll eat the donut for now. Do we have a donut animation, or are we out of it? Because there's no... We'll find out. We're going to find out if we have the donut animation, y'all. Looks like it. Okay, well, regardless, this is Talking Dough and Eating Donuts, so we do eat a donut. And this is the circus animal donut with the undefined animals on it. Anybody have any questions? Oh, that is sweet. Oh, that is real sweet. I feel like I'm being punched with sugar. Oh my God. It's so sugary, you all. I know it's a donut, but this is more sugary than the average donut. It does taste, it has that animal cracker cake taste in the icing, so I don't know how they did that. Jenny says no questions, just hugs. I mean, we all should be hugging ourselves. Although I think, Jenny, I think you're in Canada, so you're not stuck under this shit system. Newbold1 says, was there ever a point when the U.S. came close to something resembling universal health care? I seem to remember you all came close. That's an interesting question. Not really. I think the ACA was intended to provide universal health care when it was originally passed, but interestingly, the Supreme Court essentially struck down the provision that made it so Medicaid, which is low-income health insurance, was required to be expanded to every state, because the original Affordable Care Act, the goal was universal health care coverage, and it was pretty much modeled off Germany's system. And Germany's system is sort of like a structure of three different rough pairs, where the end, essentially, there's different kind of stages of which kind of program you can qualify for. That was how the ACA was sort of thought is, okay, we can get to universal coverage by kind of putting everything together. And the problem was that the Supreme Court in 2016, I believe, struck down the part that required the states that it was before 2016, I think. I can't remember what is time. Struck down the provision that required states to implement the Medicaid expansion where it was going to cover more people. And so essentially, conservative states decided not to do it, and they essentially fucked poor people, mostly in the South, mostly people of color, because those are the states that decided to not expand, mostly southern states. So pretty much they decided to fuck over poor people of color by not expanding Medicaid. And other people, but that is statistically the majority of the people. Jenny says, I'm in Quebec. We got lots of political shit going on here, but at least patients receive life-saving care. Yeah. Mm-hmm. Yeah. This is a very hard donut to eat and talk. This is so sugary. I don't think I have the ability to rate the donut on the screen. Oh, we might have the ability to rate the donut on the screen. 2 out of 5. It's too sweet. That's like the worst score I've given a donut in a while. It's not even bad. It's just too sugary. One of the employees told me that this was his favorite donut they've ever had. I very much disagree. Christopher says, you will need diabetic medication after this donut. Thank God that one donut a week does not equal type 2 diabetes. Whew. I don't need more expensive to manage diseases. I got one, and that's really the one I want to stick with. You know, if given a choice to choose between what's wrong with me, I'll stick with the devil I know. Although there is lots of data tracking involved in having diabetes in a way that there isn't with rheumatoid arthritis. But yes. That took a dark turn. Oh, so did I just rant about that for a straight hour? I did rant for a straight hour. Well, how we doing? How we doing, y'all? Are we upset? Here's what I gotta say. If you just listened to any portion of that, you already know way more about this, like, relatively uncovered Supreme Court decision this week than, like, most people. So you can just pat yourself on the back for your now very niche knowledge of a Supreme Court decision and the Medicare Secondary Payer Act. Newbold One says, so I do have another question, but it is a SCOTUS question. I can try. You know, I may or may not be able to answer SCOTUS questions because I'm not a expert when it comes to this. But Aaron says, I'm now kind of disappointed that the power hasn't cut out yet because I have a battery backup all ready to go. This is like me choosing which chronic illness I want to have. Let's not wish the power going out on any of us. The thing that I would be very upset about is if the power goes out and then we can't get it back on, which I feel like is a possibility. So Nils says, very. Newbold One says, thanks. It's basic because I am obviously not there. Yeah, I might be able to answer. This was, NLS on the forums, who's Australian, was asking a question. She was like, just like, why am I hearing so much about the Supreme Court this week in Australia? Like, why is it making to Australia? She's like, are they just issuing all of their opinions this week? And I was like, well, they are kind of issuing most of their opinions in the, like, surrounding couple weeks. But no, they're just issuing some really bad decisions this week. Tia says, I feel very disheartened by everything that's going on in the world. Feels like not many good people left in the world. Oh, I know that feeling. I think that I'm encouraged that it seems like a lot of people, even strangers that I know, are also discouraged about what's going on. And so I don't know. I'm firmly on the side of, I believe most people want the best thing, but I also believe that money makes a lot of people, including corporations who are people in the United States, make choices that aren't in the good. I don't think corporations have morality, which is why I think they shouldn't be people, and have free speech rights, as determined also by the Supreme Court. But I think that, I think there's a lot of situations in here that are resolutely a problem, but in general. But I am heartened by knowing that most people don't want other people to die. And even though there are some powerful people that are making bad choices, like Putin, that are, doing things like waging war on a sovereign nation, even though there's bad corporations that are fighting for their own corporate self-interest, and by that point, because they could, have the federal government be on the hook for a very expensive disorder, I do not believe that there is, I do not believe that most people want those kind of outcomes. But maybe this is just me being too optimistic. Okay, New Bold One has a SCOTUS question. Ash says, just got home and tuning in. I'm sorry. We were going on a deep rant there about Medicare, and kidney disease. Okay, New Bold One says, sorry. So, I thought the SCOTUS was there to provide checks and balances. Why are they checking and balancing in favor of companies and not citizens? Interesting question. I know they are supposed to interpret the Constitution, but does the Constitution is to protect people, not companies? Well, one, companies are people in the United States, which was a Supreme Court ruling. Corporations are people, which was determined under the Bush years. It's real great. And money is free speech, another thing determined by the Supreme Court. The Supreme Court is not just supposed to interpret the Constitution, it's supposed to interpret all of the laws. So while Constitution is part of it, what they're also determining is reading the law. I haven't gone to law school, so I can't tell you why they keep coming down on the side of things that I feel like are against the interest. But it is important to understand the Supreme Court is not meant to be on the side of the government. They are not a attorney general or a solicitor general, which is who makes arguments for the government. So the AG and then their deputy, which is the solicitor general, which interestingly was relevant in this case that I talked about today. But that is the government lawyers. And generally, the government will, the AGs or whatever of a state, of a city, of the federal government will bring cases to the Supreme Court where they're arguing against whatever the other party is. So if you want to make an argument about a law, like a great example being Lawrence versus Texas, which was passed in 2004, I believe, and Lawrence versus Texas essentially took all the way to the Supreme Court a Texas law that said that that made illegal consensual sex in the privacy of your own home if it was considered homosexual sex. And there were 12 other states that had so-called sodomy laws. And what Lawrence versus Texas was going up through the rungs of all of the court. So first, taking it against the state of Texas by saying that right to privacy had been previously determined by the Supreme Court. Based on that precedent set by the Supreme Court, then this was an illegal ruling because what someone does in the privacy of their own home should not be mandated by the state, which is what the right of privacy is, which is also what Roe v. Wade was determined on, as well as interracial marriage, as well as access to contraception, and as well as so gay marriage, interracial marriage, right to contraception, a bunch of things are. So yeah. Ash says, I knew what to expect. Sorry, you might have also missed the donut, which was supposed to like offset all of that, but I gave the donut a really low rating, so I don't know if it really helped. Tia says, I like your optimism. I need some of that too. Yeah, I feel like, whether or not I'm optimistic happens is a daily determinant, really. It's been a really rough week. Ash says, is there any tiny slim chance of them overturning Citizens United? So Citizens United is where we determined that a corporation is a person. Or was that covered before I got here? I actually have no idea. I don't know anything about it. I don't know if anybody's brought any cases. So they can't really overturn a ruling unless someone has brought a case. But it doesn't mean they we'll get the new docket for what they're determining next year. I think we get the docket first in September and then they start it in October. So, if there is any Citizens United lower court case that might go to the Supreme Court on appeal, then we'll see it then. So yeah, I don't know. That's actually a really good question for someone who specializes in constitutional law. I would like to know. Nils says, even with regular dialysis and a kidney transplant, such a disease isn't pretty at all. This decision is definitely kicking people who are already down. I mean, that's like the super frustrating thing about it is, the good news is that people will be taken care of. It's a shitty decision, but they will get pushed to Medicare. The downside is, of course, the precedent, and that's because they qualify if they have end-stage renal disease for Medicare in a way that we don't. But there are a bunch of other programs that weren't included in this decision that now could be interpreted by health insurance companies. I mean, one of them being the Ryan White program, which is utilized by people that have HIV to access extremely expensive HIV drugs. And the Ryan White program explicitly will cover people that have coverage on commercial insurance, but it is not economically feasible for them to get drug coverage on it. HIV drugs are already in the class of drugs where most of them are drugs that are classed as specialty drugs. They're covered by a bunch of different programs. There's like HIV drugs are in a special category for a lot of different healthcare programs. But I think the important thing to understand is that HIV and AIDS is, most specifically HIV before it turns into AIDS, is in a very special category when it comes to how much we have changed treatment. So it used to be that people might be enrolled in Medicare, but someone from treatment of that was in treatment for AIDS might last a year before they died, at most, maybe a couple years, but once it had turned into full-blown AIDS. And the treatments didn't come out really till the 90s, like the effective treatments for HIV. And then it also took quite a while longer before we made it possible to expand coverage of them, one of which was the Ryan White. But now what is important to understand is there are a lot of people who live normal length lives. There are also a category of some people that were diagnosed in the 90s who are just like got on AVT at the right time and weren't expected to live long and then are now still alive 30 years, after they originally contracted it when, the average lifespan was extremely short. But there's a last category of people that receive HIV drugs that do not have HIV, which makes it even more at risk for this kind of precedent being set. because now there is a category of people that are at high risk for HIV that take pre-exposure prophylaxis, which essentially is a slightly different version of HIV drugs that is given to people that engage in sex with men, that are intravenous drug users. PrEP being available is a huge thing about lowering HIV rates, about extending the lifespans of folks that are at high risk from it, people that are in relationships with people that are HIV positive. And this is to say that access to PrEP could be at risk from this decision. And that's really scary. And access to HIV drugs is at risk from this decision, and that could be really scary. The fact that dialysis was not considered a proxy for end-stage renal disease when 99.5% of patients that are on dialysis are receiving or have an end-stage renal disease diagnosis, because why else would you do freaking dialysis if you're not in end-stage renal disease? Those same patients, if that isn't considered a proxy by the court, then we definitely aren't going to see access to ABT therapies. I mean, now we've moved on from ABT, but access to PrEP and the other HIV drugs that are very expensive and insurers don't want to cover. We're not going to see that as a proxy at all, because even fewer patients have HIV and AIDS that are also receiving those drugs. So it's very important. Ash says, so that's a place we could potentially focus. Yes, although, yes, I think that is important. The great news is that there are a lot of advocacy organizations for HIV and AIDS that expend a ton of resources specifically on this. And once again, let's remember that it is the private pharmaceutical companies that fund these advocacy groups, and they want to make sure people continue to be able to get the drugs so that they can charge their absolutely outrageous prices to private insurers. So the good news is that, it is likely that they can be protected because they're, Gilead, who makes one of the big ones, big pharmaceutical company that makes one of the main drugs used by people with HIV, Gilead will take this to the fucking Supreme Court if they have to. But there are patients that might not have as much political power, as many advocacy groups that could be very much affected by this. And the fact that this precedent is being set is bad news for taxpayers. And patients, I think, are more important than taxpayers. But our bloated, overpriced system that exists generally when it comes to Medicare and Medicaid, and our whole overpriced system overall is every time we make a decision like this, we make it more possible for things to get more and more expensive for all of us. A great example. So Mark Cuban, who is, I don't know, he owns some sports team, but he's also on Shark Tank, billionaire, whatever. He started this thing called Cost Plus Drugs, which if you are on a drug that is expensive, I highly recommend you check it out because they have a lot of drugs. But they have negotiated rates for drugs, and they are charging people just 15% over whatever their costs are, plus a very nominal shipping and handling fee. And there was an analysis recently that looked at Medicare rates for these same drugs, all of which we should emphasize are generic drugs. They're not even doing anything that's a brand name drug. So these are drugs for which they're this is the lowest hanging fruit when it comes to the world of Medicare, the world of drugs. There was an analysis recently that looked at the Medicare reimbursement rates. So what Medicare is paying for these drugs relative to what Mark Cuban has negotiated for these drugs under the Cost Plus drugs. And across the board, Medicare is paying more money for these drugs than a private company that's been out for 8 months was able to negotiate. And this is a great example of if you increase the pool of people that qualify for Medicare, if you make it so that there is no option for people to stay on private insurance if they're receiving dialysis, then what kind of framework are you setting up when 100% of people with kidney disease are going to have Medicare as their primary payer? Well, once again, you're making it so there's like less and less negotiating power in a lot of ways. And the fact that we have such a bad, I mean, why can't we even hit this low hanging fruit of getting generic drugs negotiated as well as Mark Cuban's like baby company? Well, Congress. So anyway, sorry. I like how I was like trying to be optimistic for Tia, and then I've come back around to being depressing. Anybody have something they're looking forward to this week, or some good news from the week? Do you have any good news at all? I would like it. Please give it to me. So in totally silly but fun news for me, this morning I was able to get one of these brands that I makes vintage reproduction made in EU clothes that I love, but they're very expensive because they're made in an EU. It's a super small indie brand. They're having a warehouse sale that started at like 7 a.m. my time. They're a Swedish brand this morning, and I was able to get between 40 and 70% off on several sweaters. So now I'm Captain Sweaters for the next 10 years because I got 3 sweaters and a pair of suspenders, and I got them all like 40 to 70% off. And, you know, did I need to buy sweaters? No. But are these sweaters going to fulfill an objective in my wardrobe? Absolutely. I'm someone that, today, notwithstanding, because it's 99 degrees outside and our AC is not actually very effective, I wear a sweater at my desk, like even in the summer. So I'm very excited about my sweaters. So there's my uplifting news. Lily spent money, but she spent less money than she could have otherwise. Oh, we got more buying things news. New Bold One says, I bought a new desktop PC and I'm loving it. I knew that you were like excited about buying a desktop PC for a while, so I'm excited. I think you built it up, right? So that's very exciting. Anybody have any good news that isn't related to them just buying things? Oh, I'm also going to New Zealand after next week's stream, so soon. But we're gonna head to New Zealand as long as nothing gets changed. But Jenny says, my daughter finished elementary school this week. Her school had a cute ceremony and the kids were all dressed up. Each child was celebrated. Oh, that's really cute. Did they dress them up in tiny elementary school gowns? Because the idea of children in a cap and a hat would be really cute. I don't think that's normally how they do elementary school things, but a Yeti ate my sandwich says, it's not good news for like society. Hey, we're not asking for miracles here. I'm just asking for any good news. It's not good news for society, but I'm traveling to Europe for work and it's amazing. That's very exciting. Are you in Europe right now? Tell us where you are, and also welcome. I'm happy I'm doing the live stream at a time that works for Europe now. Jenny says, no gowns. The kids all had fancy dresses and the boys had mini suits. That's adorable. I'm very happy to hear some nice things. A Yeti ate my sandwiches in Dublin right now and going to Munich. Nice. Well, viel Spaß in München, and have a lovely time. Dublin is really great. How is the weather in Dublin? I know it's been like historically hot in the UK. I don't know if that has extended to not in the United Kingdom, really. I don't know if England's and Wales's heat and Scotland's heat has extended to Ireland, or if like it didn't make it across. Oh, rainy and cold. Great. Normal weather for Ireland. That's how it's going to be in New Zealand while we're there. Tia says, it was my birthday this week and I was dreading getting older, but it feels fine now that it's happened. Congrats. I like birthdays. I'm still in that stage where I enjoy getting older. I'm not yet at my 40th birthday, so I wonder if I might start at that point recognizing it. But I always am very happy for friends when they turn 30, because I think you're told your whole 20s that like 30 is the end of it all. But like realistically, almost everyone I know, their 30s has been way better than their 20s, because you're just kind of like a hot mess in your 20s usually. Not everybody, but A lot of people. I was a hot mess in my 20s. Fuzzbubble says, good news. Good friend is moving to my town next week. Oh, nice. Also, happy birthday to you. I'm close to my birthday. I'm like 2 weeks out from my birthday. So, we'll see. I'll be in New Zealand for my birthday, hopefully, if everything doesn't fall apart, which is entirely possible. So, I'll also, depending on how you count days, be on a plane to New Zealand for my birthday because, you know, time is wonky and I'm crossing the international date line. Tia says, that makes me feel so much better. I'm 29 now. It only gets better, at least in your 30s. That's the only one I can speak to some level of confidence was. Societally, everything has gone downhill in my 30s, but personally, I feel like I've been doing a lot better. All right, y'all. We've been streaming for like an hour and a half. It is now, what temperature is it outside? Very, very hot. There is a ride where we all dress up as royals that is happening, and I'm trying to decide if I'm willing to go out in 98-degree weather in my royal core outfit. So, I guess I gotta figure that out. Jenny says, Tia, I'm in my 40s. It gets easier. Ooh, Christopher is going to be in Montreal next week. First vacation in 2 years. Woot, woot. Lots of travel. Hopefully nobody has massive issues with plane travel because it's kind of a mess right now. All right, y'all. I will see you same time, same place next week, as long as Aaron makes it so that I can live stream myself, because there's a lot of things. There's like actually 4 laptops up on that table over there, as far as I can see. So, Jenny recommends that Christopher eat at Lola Rosa in Montreal. Iris Bears just wanted to say hi and thanks for the info. Great. All right. Well, y'all, I will see you next week. Stay hydrated. Pet a cat if you have one available. And stay safe. I'll see you same time, same place next week. Bye.